They go to work every day trying to take the best possible care of patients with and without COVID. And the increasing number of COVID cases really, it is stressful. We're back to that situation we feared last year where, despite being vaccinated, doctors and nurses are still scared of taking the virus home to their family and loved ones, and their ability to really take the best care of patients, given that they're stretched across an increasingly burdened health system. We've already seen, we know that elective surgery is paused in a huge number of hospitals. We know that outpatient clinics are either being delayed or being switched to telehealth, which is a wonderful substitute but can only do so much. We know that a number of wards that would normally be full of sick patients with illnesses other than COVID are now full of COVID patients. Emergency departments are having to have two streams of people who may or may not have COVID and trying to keep them separated. All of that extra workload, different workload, puts pressure on our staff. And also, the longer it goes on, the more impact it has, particularly on non-COVID illness. And that's our real concern going forward, is how is this health system going to manage both an increasing COVID outbreak and also that non-COVID illness that normally fills our hospitals up every day. We have confidence that for those urgent, life-threatening conditions, the system and the people working within it will do everything we possibly can to keep the excellent care of that critical and life-threatening illness. So certainly we want people to be calling an ambulance if you need to be in hospital. Certainly don't be staying at home with chest pain. But what we're likely to need to see is adjusted models of care for people with more minor illnesses, better coordination across the system so that your GP, for example, so that we can take care of you at home, but be linked into the hospital system so that everyone knows what's happening. We can keep better track of patient care in the community and still take excellent care of people, but work out how do we do that in a better coordinated way across the system. It's not so much the ventilators, it's the people to run them, the space to put them in. And really, if we're getting to the stage where we've got 2,000 people in intensive care for COVID, that is just mind-boggling. That's beyond, I think, what we're hoping to have to expect.